Good morning. Once again, welcome back. I do apologise for the technical issue earlier if you were joining us in our previous broadcast. So this is Falls Awareness with the Taunton and Wellington team. My name's Carolyn and we're joined by Hilary Cole from the Independent Rehabilitation team. And Falls Awareness is your speciality, Hilary, isn't it? So apologies, and we'll pick up and start again.
Thank you, Carolyn. Yes, many apologies. That was a technical issue on my end. I do apologise for that. So yes, my name is Hilary and I'm an assistant practitioner with the Integrated Rehab team, which is a bit of a mouthful. So I will either call it IRT or the rehab team. And I work for the Taunton and Wellington team. And we have a lot of referrals coming through, especially now with people who become deconditioned through lockdown. And a lot of those are for people who have fallen. And I have a particular interest in falls awareness. And I run a balance and safety group here at Dean Barton normally in normal times. And we also run another one over at Wellington Hospital in normal times. So the referrals that come through for us could come from a GP or a consultant or an acute hospital. Some people self-refer, or from the Southwest Ambulance Service. So a referral comes through and then we'll go out and see a patient in the community, and we will usually, but not always, do a specialist falls assessment and environmental assessment. And then based on that, we would offer equipment if it's appropriate. So that might be grab rails or I don't know, another stair rail or toilet equipment or something to help them get on and off the bed. So we look at whether equipment is needed in the first place. And then we might offer indoor mobility practice or outdoor mobility practice, and then strength and balance exercises. Now, strength and balance exercises can be offered in various different ways. In normal times, we might offer them a place on the balance and safety course. Unfortunately, they're not running at the moment. Or we might refer to a higher level course. Age UK runs some very good ones called Stay Strong, Stay Steady. They're absolutely excellent classes, and we like our patients to go through from balance and safety through to the Stay Strong, Stay Steady for a nice easy transition. So exactly the same exercises. Or there might be other exercises out in the community, Tai Chi, for example. But the main thing is with balance improvement, you really do need to improve the strength of your legs. And in order to improve your balance, you need to challenge your balance or it won't improve. So that's a general idea of what we do. All right. Yeah.
Brilliant. Thank you, Hilary. Am I right in thinking that your sessions aren't running and the Stay Strong, Stay Steady ones aren't at the moment either?
Well, our balance group here, that's not running at the moment. We're about to start a trial of doing some virtual ones, but that's a very small trial, so we can't accept patients onto that at the moment. The Age UK one's quite interesting. So throughout lockdown, they were doing virtual classes to patients who were already on their books. They weren't taking new referrals, but they were offering them to patients who are already on their books who would normally do their live groups. Okay, they're looking to start up their live groups when possible, but it doesn't look as though it's going to happen until the spring at least, and that's probably for everybody. So, and Age UK are about to open up their virtual groups to patients who weren't already on their books, so therefore they will take new referrals. They're doing that roundabout now. Okay, so it's quite.
So that's the online one. Did you?
That's the online one.
You mean?
Yeah.
Do you have the details, or would that just be on their website, Hilary?
It'll be on their website. By all means, give them a call. You can self-refer, or you can ask your GP to refer. If you are going to talk to your GP about your concerns about falls, you can ask what groups are available, and actually you might actually be better informed and say actually that the live groups are up and running and they're about to take on more referrals, and could you be referred to that group? All right. Yeah.
Brilliant. Yeah, Ruby's just put something on the live stream to say there's a short health question. Good. Great, thank you, Ruby. So you can send a paper copy for people who may not want to send something And the number is there too, 345 626. And address, which is brilliant. Thank you. It's probably good to mention at this point, if anybody was interested in that and they'd like any help with the with getting themselves referred or onto the course, we're more than happy to help with that as well. So please do get in touch if you'd like any help with that, either with the online or the phone calls and so on. That's brilliant.
Great.
That's great.
Perhaps we should say at this stage what the official definition of a fall is, because people often say, I didn't fall, actually, I just slipped off the edge of the bed. That's quite a common one. People sit too close to the edge of the bed and they slip onto the floor and they say that's not a fall. But actually the real definition of a fall, according to the World Health Organization, is it's an event which results in a person coming to rest inadvertently on the ground, on the floor, or on a lower level. Okay, and that is a fall. And the thing about falls is that very often it's more than one thing that plays a part in a fall. So people can be referred to us and expect us to come up with an explanation of why they've fallen. Occasionally we can, but usually it's multifactorial. Okay, so perhaps I'll explain a little bit about balance. When we stand with our feet hip width apart, we have a good base for support. All right. And when we're younger, it's quite easy to maintain that base of support if we're knocked off balance. And we maintain our balance mainly subconsciously. But as we get older, that ability to correct ourselves back into the area above our base of support becomes more difficult. And so it becomes more conscious to have to maintain our balance. And so our balance depends on our muscles, our muscle strength, our inner ear, our sight. There are a lot of factors that come into play. And there are a lot of things that can cause people to fall, because with aging, sadly, a lot of things that have happened. For example, we could have a medication problem. Okay, so medications play quite a big part in whether we're likely to fall. If we have a number of medications, they can interact with each other, can make you dizzy, can make you drowsy, and can make us sort of cognitively slightly impaired, or it can literally just make us giddy. And so it's quite important when your GP prescribes a new medication to you that you actually check that it won't interact with other medications that you've got. Or if you take lots of different medications, whether that's actually going to create a sort of polypharmacy situation. All right. So if you're concerned about your medications, talk to your GP or talk to your pharmacist. But if you're over 65, you should have an annual medication review. Okay.
Yeah. Great.
There are other things.
Take those things into account, wouldn't it?
Absolutely. Absolutely. Other things come into play. Continence, for example. A lot of falls happen at night, and if you get up out of bed in the middle of the night, there's often a sense of urgency. You get up, you go, and you don't allow your blood pressure to adjust, or you might sit on the edge of the bed, and as I said just now, it's very easy to slip off the side of the bed. You go to the toilet in a hurry, the light might not be on, you might be a little bit confused from having just woken up, get to the toilet or not. So if there is an issue of continence, that can often give it a sense of urgency of getting to the toilet, and that can be an issue. Again, talk to your GP if you have any concerns about your bowels, your regularity of your bowels, or your urgency of getting to the toilet, and that's actually really quite important.
Yeah.
Okay.
So a potential solution for that, Hilary?
The continence service, or sometimes medication, or sometimes further investigation as to why you might have the sense of urgency. UTIs, for example, that's another perfect example. Women are more prone to UTIs than men, and that can contribute to your likelihood of having a fall. You could become a little confused, that's quite common. Get a little bit confused, a little bit dizzy with it. You might be running a fever, so that makes you feel weak and off colour. And your bladder might be irritable. Some people also But if they are prone to urine infections, they start restricting the level of water they take in or fluid intake they have. And that's not good. You need to stay hydrated, because if you're dehydrated, that can have a knock-on effect with your medications. Your medications might not work properly, okay? Or your blood pressure might not be correct, because blood pressure can also play a part in falls, okay? So with the blood pressure side of things, one thing that we encourage people to do is when they stood up from a chair to pause, allow their blood pressure to adjust before they walk away. When we're younger, we get up and we go, okay?
Yeah.
It's very good practice just to pause, allow your blood pressure to adjust, because you can suffer from something called a postural drop, and when you get up and go. So all these things sort of play an important factor, okay?
Yeah, I had that when your lead wouldn't work.
I'm so sorry. I've given you a lot of stress. Perhaps I should explain to everybody. It's entirely my fault.
No, I'm just kidding.
No, my laptop was plugged into a multi-socket thing, which in turn wasn't plugged in. And because I've got lots of extras added to here, my battery power plummeted.
Oh,
so
sorry,
I'm really sorry. I know you're only joking. The other thing we have to joke about is, I'm going to beat you to it, Carolyn.
Please.
I was telling my family over the weekend what I was doing today, and my sister said, "Fools awareness? Are you sure you're doing a talk on fools awareness?" She said, "We all need to be aware of fools, don't we?" I said, "No, not fools awareness, falls awareness." And my daughter said, "Well, Mum, actually, you often sound as though you're I'm moving out of picture now. You often sound as though you're saying falls awareness. So we're not talking about falls awareness today. It's falls awareness."
Oh, well done for you. You know I was going to get you at the end for that.
I know, you said you'd bring it up. I thought I'd get it first.
Well done. Brilliant. Okay. So another, just going back to obviously, which is a really important subject as well, but it's good. It's really good to to laugh and lift things as well.
Absolutely.
But in terms of what you were saying about the middle of the night kind of scenario, which is really when a lot of people do fall, even though they wouldn't class it as a fall, don't they? So another solution would be perhaps to think about the environment, wouldn't it, in terms of how close you are to the bathroom, and it, a lot. And I know sometimes people don't necessarily, ideally would want to have a commode, but if you're quite away from the bathroom and it's going to be a little bit unsafe more long term to go to the bathroom, it's a solution, isn't it? Potentially.
It certainly is a solution. So as I said earlier, we do an environmental assessment. Not only do we look at what equipment we can put in, and yes, a commode might be a suggestion, we also look at home hazards, things like mats and rugs. Everybody in our team, anybody working in a rehab team, hates mats and rugs, and we always encourage people to take them up. Nobody ever does. But yes, going back to the commode, if people don't manage to get to the toilet on time, okay, it might be that there's distance between bed and the bathroom. So we might suggest a commode, and for a lot of people, they're an absolute godsend.
Yeah.
Likewise, we do have patients who are reluctant to have a commode close to where they're sleeping for hygiene purposes. And the other issue is you need to have the ability, either somebody else or you need to be able to empty the commode yourself. And for some people, that can be a bit tricky. So commodes aren't always the answer to everything.
No, or have somebody there who can assist, of course,
Absolutely.
Whether that's somebody who's able to at home or somebody that might be able to provide support, from being able to come in as a support worker or carer, definitely. Yeah. I'll just pause very briefly here to say hello to Julie, and thanks Ruby for coming along too, and hello to Fiona also, and Kieran. Lovely to see you all. Welcome.
Oh, lovely.
Yeah.
Thank you.
So that's great, Hilary. Thank you. So we were talking about, you also mentioned about how we stay upright. We've done that, haven't we? The causes of falls, one of the big ones, as you said, is in nighttime, isn't it? And medication and different conditions can also obviously cause people to become unsteady, can't they? And to affect generally.
Absolutely.
So many conditions that can do that, aren't there?
Yeah. Parkinson's is a condition. We see a lot of patients in our groups with Parkinson's, sadly, And that's not to say that it's necessarily a gloomy picture having Parkinson's, but people go through phases, and you can get to a point where turning around is quite tricky. A lot of people fall as they turn with Parkinson's, or they have bradykinesia, that's slow movements. And it can be quite easy to misjudge distances and to have a cognitive impairment where you're not quite sure of where you are spatially. It's important for us to know where we are, where we fit in our environments. Parkinson's can be one of the diagnosis behind that can cause a bit of a problem.
Yeah. So you can specialize, when you said that your team, which is brilliant, you can provide support with exercises either in the home or outside the home, and,
yes.
and you would tailor that to each person's condition and each person's mobility and so forth at that particular stage for that individual.
Absolutely. Although in normal times we'd be exercising, hopefully most people would exercise in a group. For lots of reasons, that's really beneficial. We still tailor the exercise program to the individual, because we all have different abilities and we all have different aspects coming into play that might cause us to be a falls risk. Group exercise, while we're on the subject, because this is what I feel really passionate about, patients do much better exercising in a group for lots of reasons. It's really motivational to see that you're not alone and people share their ideas. It can get very slightly competitive. We ask people, for example, how they're getting on with their exercise practice. At the start of an exercise program, or when we talk about whether an exercise program would be appropriate, we talk about the evidence-based program that we use, and we talk about the expectation that a patient will practice those exercises. We are here to support. It's a team effort. We're here to support them establish their own routine practice. So there's an expectation of practice the exercises every other day, and in the intervening day, if possible, to walk. Now, that doesn't necessarily have to be outdoors. It can be indoors. It doesn't matter if people can't get outdoors. If it's lockdown and they feel confined to the house, as long as it's safe, walking indoors is absolutely fine. Walking
or a garden,
or a garden, absolutely, or a garden. Walking and staying active is more important than anything else. And the advantage of walking is it helps us lay down bone. It strengthens bone. Okay. Swimming, although I'm a very keen swimmer, swimming does not have the same impact on bone strength, because by walking we are actually building up our bones. Because another thing that we have to consider is fractures. Falls very often go together with fractures. Okay. As we get older, our bones become a little bit more brittle, but in some cases, people can be diagnosed with osteoporosis. It's particularly common in women, especially postmenopausal women, because it can be associated with a drop in estrogen levels, all right? And so osteoporosis, we get brittle bones, and something that we call fragility fractures. It doesn't necessarily mean you're going to fracture if you have a fall, but you are more likely to have a fracture. And a fracture can impact on your way of life considerably, all right? Yeah. So the places where you're more likely to fracture would be your wrist, because sometimes when we fall, we automatically put our hands out. And so our wrists, if they're weaker and not as strong as they might be, they are very prone to having a fracture, okay? Mm-hmm. Our hips and our pelvis, and our spine, okay? Yeah. If we have osteoporosis, we can have compressed spine, and that affects our posture as well. And if we're leaning forward, sometimes we're more prone to falling forward. And if we have a hip fracture, well, that can mean you need surgery. In fact, usually does mean you need surgery, a stay in hospital, a period of rehabilitation. You come out and you're very likely to need some support in the home, having had a fracture, not always. And sometimes you might go into hospital not using a mobility aid, and come out and find you are using a mobility aid in order to keep yourself safe.
Are you talking more long term, Hilary, or I suppose it depends case by case. Well, I know it does. I've seen so many situations myself where it does depend, obviously, on people's recovery. Of course, doesn't it? A colleague of ours actually recently had a fall, which was, she's very, very fit and active and walks a lot and everything, and just had a trip, and you know who I mean. And so you're making a good recovery, which is brilliant. But its impact can be quite significant, can't it? From something like you say, you're thinking, well, I didn't really fall, or it was just a trip, but actually it can have quite a significant consequences that hopefully most people can make a full recovery for sure.
Very good.
Sorry.
I'm so sorry. You made a very good point there. A young athlete who has an injury, let's say a sports injury, a fracture, is likely to recover very quickly because they're fit, young and active. Generally speaking, this is really general, bones take about 6 to 8 weeks to heal. However, when we're older, for lots of different reasons, it can take quite a significant length of time. So we try not to tell people to just expect a recovery within 6 to 8 weeks. Quite often there's a follow-up appointment within that time, but it can take much, much longer. And the older we are, the more likely it is that it'll take a period of a lot longer than that. But you've also made a really good point about the impact of falls, in that any one of us can fall. You don't have to be getting on in years to have a fall. And for example, I slipped on ice some time ago. That really knocked my confidence, had huge impact. I broke a bone or two. And so when it snows now, I am walking very differently to how I used to.
Yeah.
And it only takes one fall to affect people's confidence. And actually, a lot of our work is about building confidence and reducing anxiety. So a lot of people say, since my fall, I haven't been outside. I don't want to walk out. I mean, I want to walk outside, but I don't want to walk out alone. So our team will offer to accompany people outside initially, setting small, achievable goals. And that's really important, to set a goal. And that is a team effort. The patient chooses the goal. They might say, well, prior to my fall, I used to walk to the post box to post a letter. Now I'm not willing to leave the house. So we might start by just stepping over the threshold or just walking to the pavement. And each time we would try to extend that distance. And very often it's really effective, and people really build their confidence quite easily.
Yeah, it's really important, because you touched on that actually about, the importance of keeping mobile and walking, and even if it is inside the house, because one of the things I was going to ask you about was the fact that people, exactly what you covered, was that people then become reluctant to move around because they're working again. And so it's this kind of, it then exacerbates the problem and decreases people's recovery and mobility. So it is really important to keep that movement, but to learn to do it in a safe way for you, isn't it?
Absolutely, that's a really good point. We actually call that the cycle of falls. So somebody might have a fall, it might knock their confidence. They then become less active. And because they're less active, they get deconditioned and they lose some strength in their legs, for example. And that in turn causes them to be more susceptible to falling again. So the main thing is, it's a bit like getting back on a horse when you've fallen off a horse. The main thing is try to overcome that fear. And we're here to help with that, really, to help rebuild the confidence and reduce anxiety, because you don't want to find people following the fall end up becoming really quite immobile, because that has a massive knock-on effect on all other areas of our health, really.
Definitely, yeah. I'm just looking at some of the links that Ruby's very kindly put up, so they're there for people to see afterwards, of course. So it's about the falls prevention support website on the government website, Age UK, the Stay Strong and Stay Steady classes, the IRT number, which is fantastic. And also request it through the Somerset Direct number.
Yes, you can request an equipment assessment through Somerset Direct. You could say that you believe you might need a grab rail or whatever. If you're just requiring equipment, you need to speak to Somerset Direct. If you're looking for rehabilitation, and if you have rehab potential and you're willing to engage in, say, an exercise program, you can be referred to our service. You can self-refer, but it's usually better to go through a health professional, like either a district nurse or your GP, or a consultant if you're seeing a consultant about something else.
We can also refer on people's behalf, by all means. We do all the time. So it's somebody that that can make that referral on your behalf professionally. Who will be. It's not that people can't self-refer, but it will perhaps help to just smooth the process and make it easier for the person to get through to the right person as well. Yeah. And what about cost implications, Hilary, in terms of the equipment and so forth?
Okay, so equipment that's provided by social services or the NHS, that's on long-term loan. There's absolutely no charge, and it's free for you to use for as long as you need it. However, you might be aware that there's a national problem of people not returning equipment once it's been lent to them. Every piece of equipment has a label on it, and it says Millbrook on it. They are the people who provide equipment at the moment, with a telephone number. So when we provide equipment, we actually stress to the patient that this is free. And also people are amazed it's free. It is free. You've been identified as needing that piece of equipment, but we ask people to return equipment when they finish with it. And that usually means dropping it off at a local hospital where it can be collected by the Millbrook people. The best thing to do is to ring Millbrook. As I say, the telephone number is on the piece of equipment, and they will give you advice on how to return it to them. It's very important to return your equipment because other people could make use of it.
Definitely. And we also, within our organisation, we have a lot of things, a lot of equipment donated to us that's not needed anymore, that shouldn't, that wouldn't have necessarily been, obviously wouldn't have been needed to return to Millbrook, would have been. Yeah. So we've actually got a stock, so it's always worth a conversation as well, and we can see what we can access on people's behalf as well, for sure. So that's brilliant. And also, I know you mentioned about the exercises, and you gave the link for us to put up about the Zing activities, kindly put up. So they're organising a lot of activities that are starting up again now, or that
you would need to look at the website for that. There are very few live groups running absolutely at the moment, and I think having sort of had a chat with other groups in the community, most of them feel as though nothing's going to happen this side of winter. There are all sorts of exercises online if people are internet savvy. YouTube exercises, they're not necessarily for falls prevention, but the ones I can endorse are the ones that the Age UK are using. As I said, Zing, just have a look on the website and see what they're running. And I do know the ones in the sports centre in Wellington, they have started the walking classes again. So so that's brilliant. They're on, I think it's Tuesdays. I'd have to double check. I think it's Tuesdays and Thursdays. So, and it's in the mornings, either a half hour or an hour walk, supervised and organised and risk assessed, so that with a maximum of 10 people. So that can go. So that's brilliant, isn't it? That is really good. In fact, I will raise that with my Wellington colleagues. They probably already know. But,
but it's just really, something going on is just like so valuable at the moment.
It is so valuable. And it's so difficult to talk about what services are actually up and running today, because we could talk about normal times, and we know that very little was running during lockdown, and that things are opening up again, but it's a bit of a funny time at the moment. So it's difficult to stay on top of actually what is running. So that's really good to know about that group.
Yeah, definitely. And I think I mentioned before, and I did a couple of weeks ago, the Movement to Music. You may know the lady that runs it, Anne Panisar. She was the one that we were doing the music little movements too, and she does seated exercise as well. She's very well qualified and experienced. And it's a lovely, soothing class. And you can seated or standing, and she will support at whatever level. And you have this lovely music in the background, and it's just a very good for your overall well-being.
And that can only be a good thing. Well-being, especially, I think we're all becoming aware of how important it is to look after ourselves. One thing I would like to say is any activity is good, and we need to stay as active as we possibly can as long as it's safe. If you are looking specifically at prevention of falls, or I should say lowering our risk of falls, in order to improve our balance, we have to challenge it. So that means that seated exercises might help a little bit with strength of muscles, but if you really want to improve your balance, you need to do them in standing or in moving. But at the moment, we're not encouraging exercises where you are traveling along or walking along too much if your mobility is not that good, because then you could have a fall while you're trying to prevent falls, which is not very good, really.
Yeah, absolutely. That's very true. So so if somebody either themselves or a family member or on behalf of a family member, if they were starting from being completely without any professional advice or support at that point, would you say go to your GP first in the first instance, or straight to yourselves if it's about risks of falling? If it's about some regular falling, would you recommend a GP appointment also? Or
okay, what I would say there is it is possible, as I said earlier, it's possible that a fall is actually related to a medical condition. And so in an ideal world, you should have a medical assessment first to eliminate other things, to eliminate a UTI, for example. Sometimes somebody has their first fall while they've got a urine infection. So go to your GP in the first instant and have a diagnosis if it's appropriate. If the GP feels though you're sort of pretty fit or pretty okay, he might then suggest coming to us, and the GP might actually make a referral to us to see what we can do. And as I say, we give lots of advice about all sorts of things. One of the things I really want to talk to you about, I'm sorry, I'm all over the place.
No, you're absolutely fine.
So passionately about this.
No problem.
Is feet. Feet, yes, the importance of our feet.
Our
feet are very important.
For walking and everything.
You don't get very far without
feet.
The condition of our feet is very, very important, okay? If our feet are uncomfortable in any way, we're not going to place them on the ground properly, okay? If we're not placing our feet properly, we will develop an unusual gait, and that in turn could cause us to fall. And the very simplest thing of all is keeping our toenails cut to the right length. Okay? If our toenails are overcut really, really short, then your toes become uncomfortable. And again, you won't walk properly. If they're too long, and this tends to happen more often than not, you don't place your feet properly on the floor. And so you need to keep your toenails cut. Now, it's very difficult to cut toenails if you can't reach your feet. So there are quite a few options here. If you possibly can, get a family member to do it, preferably after you've had a bath when your toenails are softened, okay? Mm-hmm. If you can't do that, then you could pay to go to a podiatrist, okay? And there are lots of people out there, okay? But also Age UK, coming back to Age UK, they run a toenail cutting service, which is absolutely brilliant. And they won't do anything else. They won't look at bunions or any other problems with your feet. They will cut your toenails, but you have to be referred to them. And probably
I found this out. Yeah, I found this out only last week, Hilary. I hadn't realised it needed a GP referral, and so I gave the contact details to this particular person, and he came back and said, "Oh no," I said, "Oh, I'm so sorry," and spoke. The GP then was more than happy to refer immediately. So yeah, that was a new one on me. Yeah, so that's really good to know.
And so go to the Age UK website for that. I think the details have already been put up. Go to and speak to them or look into that. But if you are interested, you need to go to GP. And also there is a charge for that service. And I don't know how it's been impacted by lockdown. So again, I'm aware of the service. I'm not quite sure what the situation is today. So we've looked at the condition of feet. But another thing I want to talk about is the importance of footwear. All right. Yes. We see a lot of patients wearing inappropriate footwear. A lot of people wear slippers around the house. I completely understand that. But there are very bad slippers out there. There are some okay slippers that are very badly worn, and there are some very good slippers. So
I'm a flip-flop girl myself.
Oh, here comes the slipper.
Where's
We
it?
can't see that.
Flip-flop girl.
Flip-flops.
Flip-flop. Oh, yeah. Which is
don't-
anything but ideal, isn't it? But hey.
Well, that's not quite so bad in that you have to grip to keep the flip-flop on. What we don't like are mules, you know, a bit like pool sliders. So you've got the band across the foot, but nothing around the back. You need really good support around the back. Okay. I haven't got an example of a mule, but I have got an example of a bad slipper. My lovely colleague, who I promised I would not name, all right, has a lovely pair of, let's see if I can get them on the screen, of slippers.
What's she called, did you say, Hilary?
She would kill me. She's waiting for these to put them on as well. So this is the front of the slipper here.
They're very nice, actually.
I won't. It's a very famous name.
Bad ones. They're bad ones, though.
Yeah, these
They're
are bad. Look.
They're bad.
So what she does is she puts her foot on the back like that. She doesn't have the back up like this, and that is very, very common because people can't reach down and they can't pull them up, and they haven't got the dexterity to put their slippers on properly. So they just slip them on, and just so that just the toes are covered. So I'm not going to name her. But they're nice. But they're nice. And I spoke to my team last night. I said, "Has anybody got any mules that I can bring in?" She said she would love to provide this example for us today. But this is a very good slipper. I don't know whether everybody can see it. There we go. There we go. Very supportive slipper, available in any independent living shop. All right. Very well-known brand, Velcro. We like Velcro. And the reason for that is that people's feet swell up very easily and go up and down, especially in hot weather, or if they're immobile, they, you know, Velcro is very good. And the back to that that's reinforced at the back there. Whoops,
I can't see it. So,
there we are.
And the sole is really
non-slip.
Yeah, a nice and got a good kind of depth of sole, so it's not going to wear easily. They do look.
There you go. Look at that.
Yeah.
So they're available, or a similar make are available at any of the independent living shops. Okay. This is another piece of equipment which is really useful. A helping hand. Okay.
They are good, aren't they?
So very often we can't reach, and we don't want to reach outside our base of support. If you remember rightly, I mentioned the base of support and how we need to keep our center of gravity. Well, if we are leaning over to get dressed, for example, we're in danger of rolling forward and falling on the floor. These are very good for picking things up off the floor. They are they're very inexpensive. So I don't think
they're brilliant, aren't they? Yeah.
Absolutely.
Can you pick your colleague's slipper up with one of those as a demonstration, per chance?
There you go.
Fantastic. They are. They're so useful, aren't they? All joking aside, they are very good. Yeah. And another thing you were going to mention in relation to being safe at home, Hilary, was Dean Helpline, wasn't it?
Oh, Dean Helpline. Sorry, I digress.
We've had some fantastic information. Not at all.
Dean Helpline. We love the Dean Helpline. There are lots of Lifeline services out there. All right, and I'm sure they're all very good. Some of them, however, will only make a phone call on your behalf. So we're talking about these pendant alarms, all right? So if you call your Lifeline, very often the person who takes the call will just ring your next of kin or your neighbour, an agreed person, to say you're in difficulty. The Dean Helpline, they will come out to you, and that's the best thing of all. They will come out to your house. Sometimes they will ring somebody on your behalf. It depends on what you've agreed. But they have emergency responders who are first aid trained. They're not paramedics, but they are first aid trained. They have a target time to get out to you, which is usually much quicker than an ambulance. The ambulance service is brilliant, absolutely brilliant, but like all services, under pressure. And the fact that you're on the floor doesn't mean that you're going to get an ambulance quickly, and you could still be on the floor for some length of time, which is bad news. You don't want to be on the floor for any length of time.
And you don't always need to go to hospital. Quite, if at all possible, people will be enabled to stay at home, won't they? And they have those raising piece of equipment too, don't they? I don't know what the technical term is for that raising piece of equipment.
A manga or an elk. Yes.
Yeah.
So a lot of people who have the alarm, they don't ring it. They have a fall. Sometimes it's because they've forgotten, with the adrenaline running, they've forgotten that they can call it. Sometimes, and we hear this quite a lot, they don't want to ring it because they think that means they're going into hospital. Okay.
Yeah.
The Dean Helpline don't want to take you to hospital unless they feel you need to. What they want to do is leave you sitting in your sitting room, having a cup of tea, recovering from your fall. And then also they do a follow-up call, because sometimes it takes a little while for shock to set in and maybe for bruising to come out. So they're very good at doing follow-up calls. But they, you know, the main thing is to use it. If you subscribe to it, use it. We also have people who don't like to ring in the middle of the night because they feel they're being a nuisance, and they'll stay on the floor until it's daylight, or if they know they've got carers coming in the morning. But people subscribe to that. And so by all means, call them out.
It's 24 hour. Yeah, it is 24 hour. They have the call centre and they're ready to go with their response officers too, aren't they? And they're always so supportive when you ring, no matter what time, day or night, aren't they? And you can wear a pendant or a wrist strap. Some people prefer wrist straps because they're not kind of, you know, and they, you know, you can take them in the shower. You can wear them in the shower. Yeah. So that obviously that's a place where you'd be susceptible to falls as well.
I'm so glad.
Sorry, go on.
I'm so glad you say that bit about the shower, because that was the next thing. People very often do take their alarms off. They often put them on the bedside table when they go to bed. And then, of course, they get up to go to the bathroom in the middle of the night. And that's peak time for falling, unfortunately. And their alarm is on their bedside table. Or they take them off to shower and they put them on the back of the bathroom door and they fall actually in the shower cubicle.
Yeah.
Okay.
Yeah.
So technically speaking, their alarms aren't waterproof, but we know that they've been known to survive going through a washing machine. They tell you that they're shower proof. So please wear them in the shower. Really important. Wear them in the shower, and don't worry if it goes to the washing machine, because the chances are it'll still work.
Yeah.
All right.
And it's just worth mentioning as a slight aside with Dean Helpline, they're also able, if people were interested, they're able to make welfare calls, aren't they? Which can be a lovely extra little support. There's a very, very small charge per call, which is, I think it's something like 99p, something like that. I'm not 100% sure of the charge now. I think it's something like that. But to have that security and peace of mind to know that that person's been contacted in a friendly voice the other end of the phone can be really invaluable too, can't it?
Absolutely, it can. The main thing about Dean Helpline, of course, is it not only does it benefit the patient, but the whole family. People who care for that patient know that they've got this facility. And actually, when families go away on holiday, they think, oh gosh, you know, I'm leaving my relative behind. But you're quite right. You can arrange to have welfare calls just for a short period of time if necessary. And it gives everybody a peace of mind, not just the person who subscribed.
Yeah, brilliant. And they have also other types of equipment that's available that they can help with as well, don't they? So that's great.
Well, they bring that equipment to our balance and safety classes, and we love it because people often fall in awkward spaces. Quite often people fall actually when they're unwell on the toilet, and they fall off and they get themselves wedged in very funny positions in a tight corner. And they have pieces of equipment, and they'll come out and they'll get you out of that. One piece of equipment is like a bit like a hydraulic cushion, and it will raise you out of that situation. Another one is a chair that they make around you, and they're great fun, absolutely great fun. And they will, as I say, they'll get you off the floor. They will leave you either in bed or in your lounge. They might make you a cup of tea if you're lucky. And if they feel you do need to go to hospital, they will support you in making that decision. All right. And they'll even make the phone call for you. Sometimes it's just quite nice. If you're wondering whether you do need emergency help or whatever, it's just quite nice to have somebody else saying, I really do think you do need to. All right.
It's so nice. And
so much better.
Yeah, and especially because if you have had a fall of some kind, it's going to, in all likelihood, shaken you up, isn't it? So you're a bit, I'm going to self-balance, and pardon the pun, but it makes you feel unsettled and anxious and worried, and it just puts you, upsets your equilibrium, doesn't it? So to have somebody there to just help you, like you said, with the decision making and just to give you a little bit of support is really nice, isn't it?
Absolutely. And there are other things that you can do to look after yourself. I mentioned earlier that overreaching makes you prone to a fall. Okay, so it's worth having a look at your kitchen cupboards, having a look to see whether everything that you need on a day-to-day basis is within reach. So your coffee, your tea, your sugar, some people keep them on the worktop, or certainly within reach. Okay, things you don't use very often, put those things in the high cupboard, or even down low, because actually you're at risk of falling if you're going down. It's a risk of continuing a bit like forward somersault, if you like.
Yeah.
You don't get something like a low cupboard. That can also put you at risk of falling. Okay?
Yeah, that's a really good point. Yeah.
And there's also your eyesight. I'm sorry, Carolyn.
No, not at all.
About this.
No, that's a really good point, Hilary. Really.
Yeah. So we need good eyesight, any of us at any time. Obviously, that goes without saying. But as we get older, we develop more problems with our eyesight, shall we say. If you have prescription glasses, make sure that you are wearing the most up-to-date prescription. We quite often see patients who have been given a new pair of glasses, took a time to get used to wearing them, didn't really get on with them, and gone back to wearing an old pair, okay? Or if you haven't had your eyes tested for quite a while and you feel you're due to go to the optician, do, because actually our eyes play a really significant part in our balance and our awareness of where we are in our environment. Yeah, that's really important.
That is a really good point. And also, Ruby, I don't know if you're able to find the link. Please excuse me while I'm also having a look here. There is a home service, isn't there, for eye tests and hearing tests as well, for that matter.
Yes.
So Ruby, you may well be able to find that in a minute, but I'll try and let you know in a minute if I can find it as well. But we can put it on there afterwards, by all means. So that's great. If people are really struggling to get to appointments, or they feel they aren't able to make that trip at the moment, then you can arrange a home visit for both eyes and tests.
Okay.
So that's great.
I'm glad you mentioned
I think it's a cost of about £30, I believe.
Right.
The last time I looked on behalf of somebody. So that give an idea of the cost, which is for a home visit for something like that, I think is that's a reasonable cost, isn't it? And if anybody needed support with anything around that, again, please get in touch and we can help with that.
Yeah, absolutely. I'm glad you mentioned ears, actually, because inner ear problems can cause a lot of difficulty with maintaining our balance. People often say they feel giddy or dizzy. That can be associated with both eyesight and inner ear. And inner ear problems actually can be more difficult to resolve. They might suffer from vertigo, or they might suffer from all sorts of things. And that is actually quite difficult to maintain or to manage. But it can actually play a part as well.
Yeah. So that's important to get that checked, isn't it?
Yeah. And we mentioned footwear. Also, our clothes can be a bit of a hazard, especially going back to the risk of falling in the middle of the night. Okay. So pajamas can be too long, right? Make sure your pajamas aren't too long. Or there are dressing gown cords you can trip over, step on, trip over. We've seen quite a few patients who do that. Another key one is, again, slipping off the edge of a bed. You sit on the side of the bed, perhaps not as far on as you should. Slippery bedding or slippery nightwear, you can easily slip off the bed onto the floor. Okay, so please be aware of your clothing.
Yeah.
That's really quite important.
Yeah, that's a really good point too. Yeah.
Yeah.
So there's so many ways, isn't there, that it can be, to have that awareness to prevent as you said, prevent the fall happening in the first place. Covered so much, Hilary. It's fantastic. I don't know if anything else has sprung to mind that you were wanting to mention. I think we covered most things we were kind of having a chat about before we came on air?
There is so much I could talk about. I could have gone into more depth as to why we fall, but I felt it's more important to try and talk about things that we can do to prevent us falling.
Yeah, actually, Hilary, I'm sure if you'd be happy to, we can arrange another session to go.
Oh, I'd love that.
In more depth. That would be fantastic. But for now, that's given us such a wonderful overview and lots of information, and
Right.
And a good few laughs along the way too, which has always helped.
I'm so sorry about the technical issue, but we resolved it.
Not at all. No, don't worry for a second. It was absolutely fine. And Ruby's put up some links for the eye tests and hearing tests, so that's great. Thank you, Ruby.
Thank you, Ruby. Yes.
Yeah.
You've got a great team.
I know, they're fantastic, aren't they? They helped me. They were scrabbling around to get us back on air. Was in the background with the technical. So thanks to everybody. Thanks Lucy as well. And thank you, Hilary. That was just, and I know you've had your background support running in and out to try and help, which is just wonderful. And
I'll tell you what, the IRT team, we're all very supportive of each other. It's lovely. Great.
Yeah. I know quite a few of your colleagues, and now it's been lovely to have spent this time with you too, Hilary, and for all your knowledge and clearly your passion for people to be safe is wonderful. And we'll certainly look to rearrange to look in more depth, as you say, about the reasons people fall and so on. That would be fantastic. But for now, thank you so much, Hilary, and
thank you.
Yeah, and
all the best to you, Carolyn. Thank you.
Yeah, and we'll see you soon. Thanks, everybody. Too.
Thank you.
Bye-bye.
Bye.